I'm Lauren Joseph. I'm a registered nurse in the state of California. Today I'll be presenting on the opioid crisis in the United States, and today helping me present are 5 Marines who work alongside corpsmen in the United States Marine Corps. Okay, today I'm going to be talking about the opioid crisis in the United States. By the end of this presentation, I hope that those I'm presenting to will be able to identify what an opioid is, what are some factors that have contributed to the epidemic in our nation, some signs and symptoms of opioid abuse, overdose, and addiction, and then finally, what are some alternatives that we could use as providers to help treat pain other than opioid use. So first off, what is an opioid? They are legally prescribed medications, most commonly used for pain. Some of your most common ones you've probably heard of are oxycodone, hydrocodone, morphine, codeine. Additionally, we have illegal opioids such as heroin, and then a synthetic opioid named fentanyl. So how does an opioid work? So it works on our nervous systems. It targets our brain by releasing impulses of pleasure as well as getting rid of the pain that we experience. While these are good factors of the drugs, however, they have a high risk for tolerance and dependence, which means as you use the drugs, your brain develops a tolerance from the initial dosage you were given. It feels as if it needs more than what it was given to rid the pain and to increase the pleasure sensations that it's been delivered since it started. Therefore, patients will go and they'll double their dosage they were given by their provider. They will go to other providers seeking additional prescriptions. They'll eventually maybe go to the street to get illegal drugs. They'll combine the prescribed with the non-prescribed, and here we have the epidemic. In a study done by Cicero and Ellis, these individuals actually interviewed abusers and found out just why is it that you use opioids? Why are you abusing them? Why did you start using them? They found that most commonly the reason was to rid themselves of pain. Additionally, they found that the clients stated they came to their provider with an issue, whether it was pain, cancerous cause, non-cancerous, chronic back pain. The provider in whom they trusted gave them this prescription that they were told would heal their pain. They used it, and they've now become addicted. And then finally, to avoid withdrawal symptoms, these clients stated that as their tolerance has increased, their dependence has increased, they have found that when they've tried to stop the use of opioids, they will begin to withdraw. And the withdrawal symptoms are just so hard on them, on their bodies, they would just rather use the opioids than stop altogether. So just some signs of opioid addiction, maybe in a loved one you know, or a friend, or clients, or patients, or even veterans that you've served with. They may socialize with different groups than they've normally ever been with before. They may be sad, they may appear lethargic, tired, they may sleep at odd times, or it could be the complete opposite. They're high energy, they talk really fast. The statements that they're making aren't making any sense. They may appear nervous. Additionally, opioid overdose symptoms. So opioids affect our respiratory system. They depress our respirations, which just means it slows the way we breathe and the rate that we breathe. It affects the depth that we breathe. Therefore, if you take too high of a dosage, you could become respiratory depressed. You could stop breathing, which could lead to unconsciousness. The unconsciousness on top of the lack of breathing could result in death. Illegal and legal opioids carry a high risk for opioid abuse, which can lead to overdose when used at too highly of a dosage content. So just a timeline of the epidemics. This kind of started in the 1990s, where pharmaceutical companies, they were falsely advertising these drugs. They were stating that these drugs were miracle workers and they helped with your pain, but they did not tell the public the dependency and the tolerance factors that came along with the drug usage. In 2010, we saw an increase in heroin use illegally in the streets. Additionally, in 2013, we saw a surge of deaths caused by fentanyl, which is the synthetic opioid we discussed. And then finally, the CDC released a statement in 2017 that 130 plus individuals are dying yearly due to opioid overdoses. And then how does this affect our economy? The CDC also released a statement in 2019 that the United States spent $78.5 billion annually to cover costs associated with an opioid overdose, abuse, and addiction, such as treatment programs, treatment such as in the ER setting, EMS personnel, or even criminal justice activity. So how do we end the epidemic? Companies are now improving the labeling on drugs so that dosages are more clearly readable, they're more clearly understood. We've seen an increase in patient-provider education. They have now placed hydrocodone from a Class 3 to a Schedule 2, which just means where it was a Schedule 3 drug, it could be auto-filled. You run out of your end-of-month supply, you can call your pharmacy, get a automatic refill. You can no longer do that. You are now required to go into your provider, have a sit-down conversation, another assessment, and then they will decide if you are deemed necessary for you to have an additional refill supply. And then we've also seen an instilling of prescription drug monitoring programs, which just helps providers keep an open track and open communication of patients who have the potential to abuse. So while we've seen a lot of patients who would try to jump from providers to providers to get as many prescriptions as possible, these programs are putting a stern stop to this because once a patient's information is entered into the system, it'll red flag if the patient's not able to, if it's not time for their prescription to be renewed. So what are some alternatives to opioids? We can try counseling, we can try cognitive behavioral therapy, we can do non-opioid medications which would have non-addictive traits. We would educate our patients more about the risks concerning them with the use of opioids, such as, a patient may come in with chronic pain who thinks that the only way out is an opioid, but when you tell them the risk and the potential consequences of use, it may change their mind, and they may want to try non-pharmacological alternatives to pain, such as massage, acupuncture, physical therapy, guided imagery. So just continuing our fight against it, we've seen that we are educating our patients more on medication-assisted treatments, programs that are designed for patients who do have an addiction can go and they can seek treatment to help this addiction. We should, as healthcare providers and people who work alongside healthcare providers, we should continue our education on this topic as this epidemic evolves and more alternative methods are designed. We should stay up to date with these changes so that we can better educate our patients. Additionally, the utilization of the PDMPs, the prescription drug monitoring programs we discussed, and then increasing access to the the opioid antagonist naloxone, or Narcan. This is a medication where we've seen an increase in EMS personnel, as far as cops, firefighters, paramedics, EMTs, emergency room providers are having better access to this drug so that when a person comes in on an overdose of an opioid, naloxone is the immediate counter effect of that drug. They've even talked about clinics having more access, healthcare provider offices, just a better access to the public in general. I hope everyone has learned a little more today about opioids and the use and some alternative methods to fighting this epidemic. And I appreciate you coming and listening to me.